Why do urinary stones happen? Break that up into two parts. One will be the lifestyle reasons, and second will be the way the body is made up. That is the metabolic reasons. So first of all, I'll go on to the metabolic reasons. That is something which is not in much control of the patient. It means that the patient have a genetic tendency, a metabolic tendency to form more urinary stones. It can be because of increased calcium excretion by the kidneys, increase in the parathyroid gland in the neck, which leads to excessive calcium excretion by the kidneys, which lead to kidney stones. And yes, genetically, few patients are prone to form kidney stones. So metabolic cause, genetic cause, not much that the patient can do about it. But lifestyle cause, yes, we need to discuss that. So lifestyle cause, first most common reason is lack of water. If you do not drink enough water, if you are staying in a hot and dry area, hot and humid area, basically in areas which there is a lot of sweating there, so the water becomes less available for the body because majority of the water is thrown out in sweat. So less water is available for the kidney to excrete the urine, to excrete the calcium, which is unnecessary, the extra calcium which is formed in the body. So a concentrated urine is formed, and this concentrated urine leads to more chances of kidney stone formation. So yes, so these are the lifestyle. The second is excessive salt intake, especially in the fast food, processed foods. There is a lot of salt in it. They lead to stone formation. Third is the protein intake. Protein intake, especially in any animal form, the artificial proteins that are available. Nowadays, teenage, when they are going to the gyms, they are taking lot of artificial proteins, much more than what is required by them. This all leads to stone formation. So these are the two most, lifestyle and metabolic. Metabolic, not much in our hand, but lifestyle, yes, 100%. Water, salt, and protein. Three things. Most common symptom is pain. So the patients come with excruciating pain. They generally come crying to us with a renal stone. So I generally say to many of my patients, there are three pains which are very painful in the body. One is a pain of a fracture, which is a displaced bone. Second is a labor pain, and third is a urinary stone pain. These three are so painful that you cannot bear it. The pain is generally in the flank region and it radiates down into the groin. So this is how typically a urinary stone patient comes. Second, they can come with infection. Third, they can come with hematuria. But most common symptom, I would still say pain. When should they consult a doctor? Whenever they are in pain, they should consult a doctor. If they have a history of renal stone formation, yes, they should consult a doctor, because a smaller stone, we can remove it with medicine. But once it passes a certain size, it becomes more and more difficult to remove with medicine. What is the diagnostic procedure for stone? CT scan and sonography. They are routinely available. X-ray. Best diagnostic procedure will be a sonography and a CT. Treatment I would broadly classify into two. One is the medical treatment, and second are all the surgical treatment available. Medical treatment, whenever there is the stone size is small, the stone is in the lower ureter, we generally try to remove it with medicine. We call it medical expulsion therapy. It involves use of an alpha blocker, a urolizer syrup, and with or without a diuretic can be given. The surgical treatment available nowadays with the technological advances that we are doing, all the procedures nowadays that we do are done with lasers. It involves passing in a camera from the place where you pass urine, that is the urethra, going, visualizing the stone, breaking the stone with the laser. With the technological advances that we are having, majority of these cases are either done in daycare or it involves a day of stay. So daycare means you come in the morning, you get it done, and by night you are at home. The next day you are up and about, you can go to the office. So the technological advances have improved, but I would still say consult a doctor early so that a small stone can be removed with medicine. Lithotripsy is another method in which shocks are delivered into your flank region. It's an OPD based procedure. Even that can be done. The most important will be drinking water, having at least 2.5 to 3. The most common questions what patient asks us, how much water should we drink? So we cannot give a general dictum, drink so much water. It depends on the area which you are staying. If you're staying in Marathwada area, you can probably need 4 to 5 liters. If you're staying in a hilly area like Shimla, you can probably drink 2.5 liters. That should be sufficient. So the dictum is you should have at least 2 to 2.5 liters of urinary output. This is the amount of urine which is needed to safely dissolve all the chemicals and the calciums which is formed in the urine. So 2 to 2.5 liters of urine output is how much we should aim for. Target your intake as per this urine output. This is one. Second, avoid salt intake, excessive salt intake, especially processed food. Avoid excessive protein intake, animal protein and artificial proteins in the form of supplements. The other thing is, whenever you have a stone, try consulting a doctor. You can do a stone analysis, find out what chemical the stone is made up of, so that your treatment can be directed towards that specific stone. There are various foodstuffs to be avoided, like we have calcium oxalate stone, uric acid stone, cysteine stones, phosphate stones, triple phosphate stones. Different stones need different dietary modifications and treatment. So once you have a stone, try getting it analyzed. A doctor, a urologist will help you out with it.